Hey guys, it's Kate with All About Ortho. Today I want to talk about the general misconception that orthopedic surgeries are a quick fix. So if you're thinking about getting surgery to resolve pain, stick around for some key information your surgeon might not have told you about. Surgery is important and sometimes even life-saving. It's amazing what surgeons are capable of doing. The surgeries that I've gotten to see in person have left me in awe of our medical field. I mean, I even got to look at a living brain, but that's besides the point. I want to talk to you about surgeries specifically that are done to reduce pain. Orthopedic surgeries with names like joint replacement and rotator cuff repair make us feel like we're a car at the shop. We'll just replace the brake pads and then we're good to go. However, that's not how the human body works. Just because the injured part is fixed doesn't mean that your pain will magically go away. And a lot of times, your pain can get worse before it gets better. I treat in an outpatient physical therapy clinic where I've seen too many people over the years that didn't quite know what they were signing up for when they agreed to get surgery. I've seen a shoulder patient that didn't know she would be in a sling for 6 weeks, unable to lift her dominant arm. I've seen a patient with a hip replacement that didn't know that he would still have the same leg weakness he had previous to surgery. And I've seen a patient with a knee replacement that didn't know that her joint could freeze into one position if she did not work on her exercises consistently, which weren't always comfortable. And each time is the same story. I thought surgery was going to fix everything. I'm not here to talk you out of getting surgery. I just want to help give you a more complete picture of what getting surgery looks like. Most people are more concerned with how long they will be in the hospital or if they will be okay from the medicines during surgery. They don't stop to ask the questions about their rehab process or their surgical precautions. So to help give you a better idea of what to expect after surgery, here are some general precautions for surgeries based on different body parts. Of course, to know your specific precautions, you're going to need to ask your surgeon that, but hopefully this will give you an idea of what to typically expect. If you have a shoulder surgery, you will likely be in a sling for 3 to 6 weeks. You will need to avoid lifting and carrying with that arm, and you will likely need to sleep in a sling in a reclined position, like in a reclining chair or on a wedge for the first few weeks. You will need to work with a professional to help gain back your strength and mobility, and that rehab can take anywhere from 12 to 16 weeks. If you have a joint replacement of any body part, there will be some motions that are very important to work on and some motions that you will need to avoid. Knee replacements take a lot of effort to regain motion, and mobility exercises will be your very best friend. Shoulder and hip replacements have motions that will need to be avoided for around 6 to 12 weeks to ensure the joint remains safely positioned. And all joint replacements will require weeks of exercises focused on mobility and strengthening. Running and jumping are generally not recommended after lower body replacements. However, with new and improved technology, that may be changing in upcoming years. If you had a hip, knee, or ankle surgery that was not a joint replacement, you will likely need crutches and a boot or cast for 4 to 6 weeks. There will likely be motions that you will have to avoid in the short term and exercises that you need to work on to safely regain your strength and motion to allow you to walk, do stairs, and hopefully run again. You'll need to work with a professional, and again, rehab will take anywhere from 12 to 16 weeks. If you had a wrist or elbow surgery, you will likely be in a brace for 3 to 6 weeks and will need to avoid lifting or carrying with your affected arm. You'll have some motions that you'll need to avoid and other motions that you'll need to work on with a professional to help regain the strength of your arm. Again, rehab can be around 12 to 16 weeks. After all that information, what questions do you have about recovery time or conservative treatment options? Drop a comment in the sections below. To take control of your physical health with expert-backed information, click subscribe and follow below.